So I want to thank you so much for coming in to speak with us today, especially because it's so early where you are calling in from. So I want to thank you extra well. But before we get started, I would love if you could give us an introduction about yourself, because not only is this your first time talking with the First Moon readers, but this is also our first formal introduction. So if you could let us know where you're calling in from, your pronouns, and I'm always a little nosy about personality types. So if you know your Enneagram or your MBTI, I'd love to know, and anything else you'd like to share with us.
Okay, great. So my name is Sam. I am 22. I live in Southern California, and I am a full-time college student, a senior, so I'm almost done. And my personality trait are I'm an INFJ, and then I also have she, her, hers pronouns. So yeah, that's just a little bit about me.
Sounds great. I'm an ISFP, so we're both introverts. That's good to know. Um, our first question, I would love to know, or if you could explain the more scientific or medical definition of endometriosis and how you would personally define it.
Yeah, so endometriosis is where tissue similar to the uterine lining can spread throughout the body, can cause a lot of problems, symptoms, and complications like painful and debilitating periods, pain with sex, pain with bowel movements and urination. And this tissue can be found anywhere in the body. So it's not just centered around the pelvic region. It's been found in the brain, the heart, the lungs, pretty much any part of the body that you can think of. It's been found there. Um, and it's no cure, and it's really hard to manage, and there's not a lot of treatments options out there for us. So yeah, it's a really terrible and debilitating disease that over 200 million people worldwide have. So yeah, it's pretty bad. I hate it.
So when did you realize that your periods were different from your peers? Was like menstruation a topic that you guys spoke about openly, or was it more of an uncomfortable thing?
um I mean, I personally was able to talk about my periods with at least my mom. So immediately when I turned 13, my periods were debilitating. They were super heavy. And I noticed that my peers around me weren't really having the same problems. Like I would have to skip school a lot, or I couldn't participate in PE on my period because I'd be like throwing up in the bathroom. Um, so I just thought that was weird, just growing up and not having other people around me have that same experience. So I did end up talking to my mom about it at a very early age, like 13 or 14 years old. And of course, she was like, yeah, that doesn't sound normal. I don't have that. So we're going to take you to a doctor. And, they give you the same answer as everybody gets, that period pain is normal, sort of thing. But yeah, I just noticed from a very early age that my periods were uncontrollably heavy and super painful, and nobody else around me was really dealing with that. So
Yeah, it's good that you got it and knew that something was wrong at an early age, because during my research for today, I watched a video where a woman said that she didn't know that she had endometriosis till she was 25, which I thought was absolutely crazy. And I can't imagine like living that long without knowing what's happening to you. Um,
right.
but as you spoke about going to the doctor, I was wondering what diagnosis was like.
Yeah, so diagnosis for endometriosis is tricky just because there's a lot of different variables that are playing into it. So, like the woman that you mentioned that didn't know she had it till 25, she likely was told by multiple doctors like that is normal, or even peers or family members. There's like this stigma and misconception that periods are supposed to be painful, that you're supposed to be like, curled up in a ball and like throwing up and all this bad stuff during your period, which is just not true. The bottom line is your period should never be so debilitating or interfering with your daily activities or your life. It should always be just very minimally crampy, maybe, and just a little bit uncomfortable, but it should never be anything that interferes with your daily activities. And the problem is when you go to doctors and you try to get a diagnosis, a lot of them will throw that in your face and continuously say, like, it's not that big of a deal. Your pain tolerance is probably just low, or maybe you have stress or anxiety that's making it, worse than, the normal. And you need to like come up with ways to de-stress or whatever, or they just plain out say like, that's totally normal. Like so many people have that. So it's just hard to get a diagnosis. And On top of that, there's the only way to know is through surgery. So you can go to doctors and they'll do scans or they'll run blood tests like normal panels, and everything will come back clear because endometriosis doesn't show up on scans most of the time unless you have like a cyst, which is like an endometrioma, which is really common to have within the later stages of endo. So you can get an ultrasound, and if it shows you have a cyst, they don't know what kind of cyst it is until they open you up anyways, but they can make judgments on if it is an endometrioma or not. And then in terms of other tests that you can do, MRIs, deep infiltrating endometriosis MRIs can potentially show it, but not everybody has deep infiltrating endometriosis. And again, it only shows it in your pelvic region. So if you have it outside anywhere else, you won't know. So really the only definitive way to know is if you go through a surgery with a specialist.
So once you go through that surgery, what are your treatment options like as you move forward?
Yeah, so the best form of treatment is excision surgery, which they would do at the same time of your diagnosis surgery. The best form of treatment out there at the moment. There's other forms of surgical removal that they can do, like ablation. That's where they actually burn the tissue off, but that one has like a higher reoccurrence of endometriosis growing back faster and less relief overall. And then in terms of non-surgical treatments, you can do birth control pills, but again, that's not going to like do anything to the tissue growth. It's just going to help the pain and the symptoms that you might be experiencing. And then there's other prescription drugs out there that can stop your periods or put you into medically induced menopause, which again isn't going to cure it, but it can help with symptoms and pain. And then other than that, there's also natural ways that you can try to manage it. That's kind of just like with heat, TENS machines, pelvic physical therapy, trying to find foods that make your endometriosis worse potentially, supplements that may help with inflammation and stuff like that.
Could you speak a little bit more about the holistic methods, especially the foods that you could avoid?
Yeah, so endometriosis is known to be an inflammatory condition. So when you eat foods like dairy or gluten or red meat, caffeine, sugar, alcohol, stuff like that, it can potentially make inflammation in your body worse, which can attribute to more endometriosis symptoms or worse pain with endometriosis. So a lot of people find that some foods end up triggering their endometriosis to be worse or causing flares. Personally, for me, gluten is like a big issue with me. I'm very intolerant to it as it is, but that one really causes a lot of flares with me. And so does dairy, and for some reason, soy. And that it just depends on the person. But it's kind of important to make sure that you know which foods can attribute to your specific endometriosis, because it's not the same for everybody. Some people find that food has nothing to do with them, like it really doesn't affect them either way. And some people it makes a huge difference, just like avoiding certain foods that can trigger theirs specifically. So, yeah.
And speaking of the inflammatory aspect of it, you speak a lot about Endobelly. I was wondering if you could explain a little bit more about what that is and how to manage it. Yeah.
Yeah, so Endobelly is basically where you are bloated with your endometriosis. It can be due to a lot of different things. It can be due to just scar tissue and adhesions. It could be due to just pelvic pain, digestion issues that you may have with endo, so like SIBO or chronic constipation. So a lot of different things that can play into Endobelly. But again, it's just all about that inflammation. And for me with Endobelly, I don't get it as frequently as some people do. Some people have, that's like their main symptom. They're always having endobelly problems. But for me, I get endobelly here and there. And I find it's really when I am, eating foods that aren't, sitting well with me, or, I find that it helps when I take anti-inflammatory supplements, or I do things to help, detox my body better. But overall, yeah, that's kind of what endobelly is.
So going back to the surgery, I've read also that some sufferers have to go through surgery more than once, sometimes 6 times, and I think that's crazy. So I was wondering, since your surgery, have you been experiencing any pains, or has the pain been obsolete for you?
Yeah, so with surgery, it's not a cure. So a lot of people will have to get surgeries multiple times throughout their lives just to manage the growth and complications that can arise. For me, I've had 3 total so far, but 2 of them were not really just for my endometriosis. One of them was just to remove a cyst, and then the other one was an exploratory surgery. But after my last excision surgery, which was my very last surgery that I had, that one I had a lot of relief from. I'm still having a lot of relief from it. I'm almost a year post-op. I don't have as much pain as I used to. I won't say it's completely gone, and it's definitely every, you know, so often I'll get flares or I'll feel pain again. But it's a lot more manageable for me now that I've had the surgery, and I'm hoping that it continues to be somewhat easier. But it's unfortunate that there is no cure for this disease because surgeries are not easy.
Mm.
Um, and even though doctors will tell people, oh, it's really a non-invasive surgery, with laparoscopy, it's just tiny little incisions that you won't even like have problems like 3 or 4 days after you can go back to work. That's just not really the case. Personally, for me, it took me months to recover from my last surgery just because it was so extensive and they were working on a lot of different organs in my body. And it's just, difficult to have so many surgeries. And, some people don't get any relief from them. And some people do experience relief. So it's really, hard to, decide if you want to get surgeries or, people have a hard time, like, with the idea that surgeries can actually cause scar tissue and more adhesions. Just with any other surgery, you're always going to get scar tissues and adhesions. So yeah, it's a tricky thing.
Yeah, I'm so glad though that you were able to find some kind of relief through it. And going back to when you were speaking about like school and you having to miss school and also being a college senior, that's super exciting. I hope for great things after graduation for you.
Thank you.
I was wondering how you were able to manage pain and all of your chronic illnesses with school and work.
Yeah, so it's really hard. For me, I feel like my symptoms are definitely not as bad as some people. Like some people can't even work. They don't have jobs. They can't keep a job because they can't function on a day-to-day basis. For me, school was really hard to manage, but I had a lot of help from just the school itself with the disability center. And if you have chronic illness in general, I highly recommend to chat with your disability center at your school or a counselor of some sort of advisor, and just tell them your situation, get all the necessary medical documentation you need to show them that you need accommodations, and just really put a plan in for your specific needs because it's hard to manage pain and doing school and stuff. And I even had to skip out on one of my semesters because I was having surgeries and I just couldn't keep up with all of my work. So it's been hard. Another tip that I have in general is just to try to, make your schedule the best for you and your situation. Don't try to overdo it. Take as much time as you need. I know a lot of people think like, oh my gosh, I need to graduate within 4 years or whatever with college. It's just not the case. Like you can take as long as you need. You can take a couple classes each quarter, and if you don't, finish in the 4 years, that's okay. And just also procrastination, stress can cause inflammation. So if you're if you're stressed out with all of your classes and the heavy load that you're taking on, you're likely not going to be able to do as well as you would if you were to kind of split things up or time manage better. So I found that not procrastinating, even though that's really hard for me because I'm just a natural procrastinator, is really helpful just to help with stress levels and anxiety. But yeah, main points: definitely talk to your counselors, advisors, disability center if your school has one, and to make sure to spread out your schedule. Don't procrastinate and try to make things less stressful for you. Take your time. And then with work, same thing. At least in California here, there's a law where you don't have to necessarily tell your employer that you're, chronically ill or you have a medical condition, but, you could just go to HR instead of telling them. I always recommend to keep it honest with your employers. Tell them, you don't have to disclose it during an interview or anything, but just tell them, hey, you know what, I have this condition. This is how it's going to affect my work and, my work ethic and my abilities. And, I need certain accommodations met, and work with HR, the company that you're at, And a lot of the times it's, they're really understanding and helpful. At least in my experience, the HR departments are always helpful and with my scheduling and just making sure that I have accommodations. Like for me, I can't stand for too long. So when I was at a job where I was on my feet all day, they provided, chairs in the back where I could sit for a couple minutes just to take a break. And yeah, so just make sure that you're really open and honest with your employers and HR, and you'll find that a lot of people are a lot more understanding and helpful when you do that.
Yeah, I'm glad that they were accommodating to you. I was going to ask if you know anybody or face discrimination yourself, so I'm glad to know that that wasn't a case for you. But speaking of school, I was wondering how you think schools should navigate educating young menstruators, because I feel like not enough young people know about endometriosis.
Yeah, I definitely never knew about endo until I got the diagnosis, which is honestly sad because it is so common to have either endometriosis or PCOS, even other kind of reproductive issues. Um, I really think it should be taught at a young age. It should, because the signs of endometriosis start at a young age, and the quicker you catch it, the better off your long term, is, because you catch the disease when it's not progressing necessarily. But just in general, I think sex education in school, middle school, high school, it sucks. It's terrible. It's really not as comprehensive as it needs to be. There's a lot of things left out for both men and women, with STDs and, regular, just everyday health. I know people that have reached out to me and they didn't even know what discharge was. And I was like, man, it's just so like sad that we don't educate people, because there's so many people that think, you know, discharge is weird and they're uncomfortable about their bodies and they don't know what's going on. Or they have these symptoms like painful, heavy periods, and they don't know why because nobody else around them has them. So they think it's just them, like it's something wrong with them. And yeah, so overall, I really think that the sex education in schools is lacking. And even in medicine, like medical school, I've had friends that are in medicine and they're like, we don't even learn about endometriosis for the most part. It's like basically a footnote in our textbook that kind of says, oh, this is what it is. But we never go into detail about, how to treat it, what the condition actually is, and how it affects people. It's very lacking in research and education. And it's sad.
Yeah, I completely agree about the sex education thing and about the medical students too. That's crazy. I also watched another video where two female gynecologists who suffer with endometriosis were like, I didn't know what it was until I was experiencing it in my 20s and I had to do my own research about it. And that's crazy because, like this is a medical issue, and for actual doctors to not know about their own bodies in that way is, I think, scary.
Yeah.
But I was speaking of young people and like learning. I was wondering how you would tell a young menstruator who believes that they have endometriosis to advocate for themselves, because some doctors, as you spoke about, won't believe you or think that you're lying and a hypochondriac. So how would you best advise them?
Yeah, so this is a problem that so many of us face, going to doctors, especially at a young age. A lot of doctors will say, there's no way you have it because you're so young. And there's like this misconception that you have to be like between 30 and 50 years old to have endometriosis, which is just false. It really can start at any age. There's even research out there that said that it's been found in fetuses before. So it can even be found, at birth, which is just crazy because a lot of people will think, oh, it's the uterine lining. That's not true. It has nothing to do with the uterine lining. It's more complex than we actually think it is. But in terms of advocating for yourself, it's really important to just be upfront and honest, and just tell them your concerns. Like, hey, listen, like I have these problems. They're affecting my day to day. Something needs to be done about it because I can't continue to live like this. And I want, certain things tested for. And if you can't do that for me, that's fine, but please refer me to somebody who can, because I can't continue to live like this. And I know it's not just in my head, it's getting worse. And even say like, hey, I've been, dismissed by so many doctors before. If that's the case, like they're still trying to find a diagnosis after many doctors, just be honest, like straight up. I need to know what's wrong with me. If you can't tell me, you need to refer me to somebody who can. And unfortunately, really the only doctors out there that are going to listen to young patients with endo are endometriosis specialists. So I always recommend, if people suspect that they have it, young or not, please see an endometriosis specialist if possible. Even though there's not a lot of endo specialists out there for us, it's really the only way to get a definitive diagnosis, because gynecologists are going to look at you and say, I'm not going to do a surgery on you. You're too young. I don't even know how to do the surgery potentially. So, we can say you have endometriosis and treat you with birth control pills. And that's that. You know what I mean? So it's important to try to see an endometriosis specialist if you're looking for a definitive diagnosis. I know a lot of people don't want to get the surgery and they just would rather say, okay, I have suspected endo, I'm just going to treat it with medication. That's fine. That's your choice. But if you are trying to get a surgery for a definitive diagnosis, you need to see an endo specialist. It's so important. And also just like journaling your symptoms, I find is so helpful, because if you bring a journal with your symptoms and how they affect you day to day, it's really helpful for not only you to remember in a situation where maybe you're nervous or, confrontation arises because a doctor's dismissing you. It helps you remember, what you came for. I need, help with these symptoms. This is how they affect me day to day. And it also gives your doctor kind of like this initiative, like, oh, okay, these bad, otherwise she probably wouldn't be doing that. Like, she's really determined to figure out what this is. So I think it's always a good thing to just journal your symptoms, bring them to your doctor's appointments. Make sure you always have all of your medical records possible that may, be helpful for them. And just always make sure that you have questions written down. Questions and concerns. Again, I always get flustered at doctor's appointments because I'm nervous. And the moment that somebody starts questioning me, I freak out internally. And I find that I forget everything that I came for and I just shut down. So it's always helpful for me to just write down things ahead of time, questions, concerns, symptoms, and just have that documented so you can get, some sort of, help with that. And yeah, I think that's all I have for like advocating for yourself.
Yeah, I think those are all great points, especially writing your symptoms, because I was able to speak to someone earlier this month about PMDD and making sure that you write your symptoms to go advocate for yourself, because that's just another thing that doctors don't believe you about. So writing everything is super important. But when it comes to the endometriosis specialist, I was wondering if you had any tips about finding the right one or the best practitioner for you, because even though they are small in number, I'm sure there's like better ones and worse ones that work for you.
Yeah, so in general, there are no qualifications or requirements that doctors need to go through in order to call themselves specialists. So any kind of gynecologist can basically slap that on their name and say, I'm an endo specialist, even though I don't have any education or knowledge or background. And a lot of the times I went to specialists and they would tell me false information about the disease. And that's a really great indicator. If you go to an appointment with a specialist and they tell you, oh, endometriosis is the uterine lining. Nope. Endometriosis can be cured with birth control. Nope. It's all red flags. You want a doctor that's going to be honest and knows what they're doing. And in general, the best database out there at the moment is Nancy Nook. So if you just Google search Nancy Nook, it's basically this woman. She made this whole website, for resources and help with endometriosis. And if you, there's like an icon on the website that helps you find your specialist near you. You can kind of search in the area. Some people like to travel because they're in areas where specialists just aren't, available. So yeah, that's the best database I recommend that people go through to try to find a specialist, because those ones are actually qualified. Like they have the knowledge, they have the background. It's been determined by multiple endometriosis patients that these doctors know what they're doing. And it's just easier to find a legit specialist that way. But if there's nobody in your area and you can't travel, try to find a gynecologist that will at least listen and they at least know that there's nothing that they can do for you besides medication. And just try not to go to doctors that have these like misconceptions still about endometriosis, because it's it doesn't get anyone anywhere when you're going back and forth with, oh, birth control is going to cure you, or it's not that big of a deal, we can fix it with this, or whatever the misconception is. So yeah, just trying to find a gynecologist or a specialist that knows what they're doing is important. And there's a lot of signs that you should look out for.
Thank you so much for the recommendation for the database, Nancy Nogue. I'm definitely going to link that for everyone. Um, but speaking of like the red flags, I was wondering what other myths there are about endometriosis that people should look out for.
Yeah, so like the ones I already mentioned, endometriosis is not the uterine lining. It's been proven multiple ways. I mean, there's even men that have this disease. It's super rare, but I think there's like about 20 so far cases reported in men. So that's a good indicator that it has nothing to do with the uterus, okay, because they don't have one. Um, and it's also been found in, like I said, fetuses. So if they're not menstruating and the uterine lining isn't shedding, how do they have endometriosis? Well, it's not the uterine lining. It's tissue very similar to it in some ways, but it's definitely not the uterine lining. It's a big misconception. And that is honestly a really dangerous one, because a lot of doctors will prescribe pills that stop your period and say, as long as you don't have a period, you're good. Your endometriosis won't progress. It won't get worse, or the tissue won't spread. And same thing with a hysterectomy. They'll perform hysterectomies. That's not a cure, because removing the uterus doesn't do anything to the tissue. Um, so that one is specifically very dangerous in terms of treatment of the disease, because a lot of doctors will treat it wrong based off of that information. Other misconceptions, that it's just a bad period. Definitely not. It affects literally every aspect of your body. It can be found anywhere in the body. You can have symptoms, depending on where they're located. So for me, I have thoracic endo or diaphragmatic endo. So I had breathing troubles. I had coughing during my periods. I had severe chest and shoulder tip pain during my periods, and even chronically. And I just never knew what it was. And a lot of doctors kept telling me, oh, it's just anxiety. You have chest pains because of anxiety, stress. Yeah. So it can affect a lot of different areas in your body. It can create a lot of different symptoms, and it's debilitating. And it doesn't have to be just around your period. It can be chronically every day. Some other misconceptions besides that there's no cure, that people say that surgery is a cure. Not a cure either, unfortunately, because we just haven't figured out exactly what's causing it. Trying to think of other ones that are misconceptions in general. I think those are just like pretty much the baseline ones, that it's just a bad period, or your symptoms are only about your period, that there's a cure for it, or that it's the uterine lining. Those ones are just the main misconceptions that can cause a lot of different issues with getting a diagnosis and treating the disease in general.
That's great to know. You speak a lot about your two other chronic illnesses as well. I tried to put them on Google pronunciation, but I can't remember them now, so I apologize. But I was wondering if you could talk about those as well, and if they're related to endometriosis. Like, do other people with endometriosis usually also have these, or are they individual?
Yeah, so they can be individual, but a lot of the times they're attached to different chronic illnesses. So, and especially endometriosis. So when you have endo, the two most commonly, reported, or I guess I'll add a third one, comorbid chronic illnesses is adenomyosis, which I have, interstitial cystitis, which I have, and then PCOS also. A lot of people with endo also have PCOS. And adenomyosis is basically when the uterine lining actually, attaches itself to the muscular wall of the uterus. So that one can be cured with a hysterectomy, because it is the actual uterine lining, attaching itself to the muscular wall of the uterus and causing a lot of different symptoms. Can be very similar to the symptoms that you may experience with endometriosis: painful, heavy periods, pain with sex, just chronic pelvic pain and pressure. And then interstitial cystitis is painful bladder syndrome. So the best way I describe it to people is that it feels like you chronically have a UTI, even though you have nothing coming back on your urine cultures. So I chronically feel like I have a UTI. I have pain with urination, and I also have pain with sex, which is a common symptom with IC. And for that one, there's no cure. And really the only way to know if you have it is your doctor basically has to run tests to make sure it can't be anything else, because there's not a test out there that says, oh yes, you have IC. You just basically have to rule out everything. And then they'll say, well, everything else is ruled out, everything's coming back okay, you don't have any kind of infection or nothing's going on, so we're just going to say you have IC. So yeah, those are really common to have with endometriosis.
Oh, so speaking of painful sex, I know that penetration in any form can be really difficult. I was wondering if you found ways to manage it, especially in those like intimate settings.
Yeah, so I have been seeing a pelvic physical therapist for a couple years now, and honestly, if anybody out there experiences pain with sex, please see a pelvic physical therapist. They can really be helpful for some people, especially in my experience. I've found it to be the most helpful thing for painful sex in general. Just learning how my pelvic floor muscles are so tight from all the endometriosis and all the other chronic illnesses that I have, and how there's ways that we can decrease that and learn how our bodies react to certain things and how we can control that and manage it through stretching. And also pelvic physical therapists do internal work with fingers and dilators to help relax your pelvic floor. So I have found that that's been the most helpful. And just in the bedroom setting, there's certain positions that are better for people that have pain with intercourse or pelvic pain. There's a highlight on my Instagram where I posted the worksheet that basically says these sex positions are really common, and here are the pros and cons to them, and here are the best ones for people with pelvic pain and pain with intercourse. So I highly recommend to check that out if you are interested. And then just in general, deep belly breathing, I have found that to be really helpful before and after sex, and just doing like stretches and stuff like that and managing with that. But I will say the most helpful thing for me, of course, is my surgery. I really had a lot less pain in general, and that includes pain with intercourse after my surgery. So
Speaking of the intimate setting, I was wondering if you have any tips of like people that may be scared of letting their partner know that it's going to be a painful experience for them, and how that they should navigate that.
yeah, I mean, it's tricky. It's hard to be vulnerable in that way and talk to just generally anyone about pain with intercourse, because it is often looked at as not a good thing, and people will look down on you, or even I've had men not want to have relationships with me because they need more, or what I'm it's just ridiculous. But anyways, um at the end of the day, the best advice that I can give to people is that if your partner is not willing to accommodate or understand, or you're too afraid to tell somebody, they're probably not the right person for you. You should be comfortable with your partner. Your partner should be accommodating. They should be understanding, and they should never force you or make you feel bad for the condition that you have, because it's not your fault. It's not your fault that you have this. It's not, you can't do anything about it. Your partner should be understanding of that. And that's honestly the best and worst thing about this disease in general and chronic illness, is you will find people in your life that are just not genuine, or people that you should keep around. And it's good. It's hurtful. It's sad, but it's also good because you find the people that are actually genuine and will be there for you to support you in any way. So yeah, overall, just, I know it's hard, but you should really be open with your partner and try your best to explain to them the disease in the best way that you can, and how it affects you, and how sex is painful for you. And they should be understanding if they're genuine and the right person for you.
Yeah, you definitely should root out the bad ones as fast as possible.
Yeah.
I was also wondering like what your just general essentials are for dealing with pain management.
Yeah, so I personally use cannabis products. So I use CBD either in the form of like oil, or I have bath bombs that are CBD bath bombs, or Epsom salt bath mixed with CBD. That's amazing for me. Then I also use THC products as well. I have found that certain supplements are really good for me. So like turmeric, which is anti-inflammatory, magnesium, omega-3, just taking those on a regular daily basis has been helpful for me, just managing overall inflammation and pain. And then like in the moment kind of pain, heat pads, TENS machines, pelvic physical therapy is really helpful for people with all sorts of, symptoms of endometriosis. And I want to say that's it. And besides the food thing, like just cutting out foods that don't sit well with me and cause flares.
Yeah, I think CBD is an all-rounder savior product for so many people. I also love CBD. I struggle with PMDD symptoms, and CBD is like godsend. So
Yeah. Yeah.
it's amazing. I've actually like flown through most of my questions, so I want to thank you so much. Um,
Yeah.
but for my final question, um, endometriosis obviously is something really hard to live with and to deal with, but I was wondering if you found any positives dealing with it.
Yeah, so there's a lot of positives that I've learned along the way. Just like having general chronic illness, you learn to basically take the little things and make the most of them, enjoy the things in the moment, don't worry about or stress about things in the future, because you can only control what's, available to you. And with chronic illness, you can't control really anything. So just learning to be patient with myself and others has been really helpful. And just also the community and getting the chance to meet so many people with chronic illnesses of all types, and also just being able to meet people with my specific chronic illnesses and getting to connect with them and make friends and find that support that you wouldn't necessarily get with people that don't have it, because they just don't understand. And that's just the bottom line. So with chronic illness, I always tell people, like, reach out to people that have it. You will find that 99.9% of the people with chronic illness accounts on social media, as long as you reach out to them through DM, they'll respond to you, and they'll, want to form connections with you and be there for you, because it's extremely isolating and hard to, manage, especially at a young age when everybody your age is, going out and doing all these things and you feel stuck. So yeah, just being able to have that opportunity to meet people and form connections with other people with chronic illness has been really great. And I think just overall, the strength that I've gained within myself and the confidence that I have in myself, just getting through everything that I have and just realizing that I'm a strong person, has been really helpful for me and just my growth in general. I used to be really shy and I still struggle with it. And I'm not as shy anymore. I feel more comfortable talking in public settings and doing things that I wouldn't necessarily do. And I kind of attribute that to all of my, experiences with chronic illness and having to go through so much alone, and realizing that, I'm strong. So yeah, those are kind of some positives that I've learned with having endo. But most of it is not very fun. I won't say that I have days, where I'm extremely frustrated or upset that I have it. Of course I do. I'm, trying to be as positive as I can, but I'm not here to ever teach or preach toxic positivity. I don't think that's helping anybody. This disease is horrible. It's a terrible, terrible disease to have. And you should never be happy that you have it or grateful that it's not worse or anything like that. But just taking it day by day and just trying to be as positive as possible, and, looking at the glass half full rather than half empty is, some things that kind of come along with having these chronic illnesses.
Yeah, you've been able to build such a beautiful community on Instagram and TikTok, and it's really amazing to see how much your advocacy means to so many people. So I wish you more success on that and getting the word out about endometriosis and everything. So I want to thank you so much again for taking the time out of your day to meet with us and now become a part of the First Moon family. So yeah, thank you so much.
Awesome. Thank you so much for taking the time. I really appreciate it, and letting me share all my, stories and stuff like that.
Of course, we love to hear them. So thank you.
Of course.
All right, I'll stop the recording now. All right, bye.
Bye.
Have a great day.